Good morning, everyone. Welcome to the California Budget and Policy Center's Empower 2021 event, Confronting Racism and Advancing Health Equity. I'm Janice Yee, Director of Advancement at the Budget Center, and I'm glad we are all here to have the conversation today. The depth and reach of racism, especially longstanding racist policies, are so ingrained in our society that sometimes we don't recognize those barriers as racist. This blocks so many communities from the opportunity to be healthy and thrive. And we're seeing that firsthand with this COVID-19 pandemic. To address this, we must declare racism a public health crisis. And today we will go over why that is so critical. At this point, Empower is a program that reflects the Budget Center's efforts to connect people and policies in order to create real progress. Our goal with this series is to empower all of you with the information you need to advance smart policy choices and public investments. Empower is also a free public education resource that is made possible by today's event sponsor, the Heising-Simons Foundation, and viewers like you. In case you missed it during registration, if you make a $25 donation or more, you will receive this amazing poster pack from the Budget Center. So shout out to Nioska Alaya and Stacy Hiramoto, who have been invaluable allies to our work. If you would like to empower our programs, you can do so at our website, calbudgetcenter.org/support us. Also during registration, you were given the opportunity to submit questions. Those have been included in the program. All right, let's get started. We will begin with an overview of the Budget Center's recent report, Confronting Racism, Overcoming COVID-19, and Advancing Health Equity by Monica Davalos, Research Associate at the Budget Center, whose work includes housing, health, and criminal justice, and co-author of this report. Building off of Monica's presentation, we will have a discussion on the pervasive depth and reach of racism in the health of Californians of color, and why declaring racism as a public health crisis matters. This discussion will be moderated by Crawford, Executive Director of the Western Center on Law and Poverty. Crystal has played a pivotal role in advancing the health and economic security for low-income Californians, women of color, and communities of color. And we are beyond excited to have her with us today. Crystal will be joined by Adriana Ramos-Yamamoto, Policy Analyst at the Budget Center, whose primary focus is on health, and the other co-author of this report. Adriana comes from a public health background, including serving as a health educator for the LA County Department of Public Health. Zella Knight from Housing California's RUN program, which is Residents United Network. She is a self-described disabled generational activist with lived experience of homelessness, housing instability, and security. Zella is a forever advocate in the intersectional topics of housing, health, education, social, and racial justice. Also joining us is Rosemarie Molina. She is the organizing director of LA Fed, with a history of creative campaigns to fight for structural changes that address the economic, social, and racial inequities. Rosemarie is also a widely recognized leader in fighting for working class communities of color in Los Angeles. As you can see with this powerful woman panel today, intersectionality is so important to population health. There is so much we're going to be covering with such amazing presenters, so I will stop talking and turn things over to Monica Davalos.
Hi, thank you, Janice. Hi, everyone. My name is Monica Davalos, and I'm going to share with you an overview of the report that I co-authored along with Adriana, who you'll meet in a bit, called Confronting Racism, Overcoming COVID-19, and Advancing Health Equity, to help set up the conversation today. So this week hit the 1-year mark of the stay-at-home orders here in California. And by now, many of us know someone among the more than 3 million Californians who've tested positive for COVID-19, or maybe even have had a friend or family member become sick from the virus. You may also know that the pandemic is disproportionately hitting communities of color and further exacerbating existing racial health inequities. And this is why we at the Budget Center thought it was important to really investigate the root causes of this and how we can begin to address it. So our report calls on policymakers to declare racism as a public health crisis, since it is an important first step in addressing racism and advancing racial equity in California. Because one, in order for our policymakers and our leaders to solve a problem, we need to define it, which California has yet to do. And secondly, is that declarations are often an important first step in prompting policy action and the allocation of resources to address any major issue that's harming Californians, and in this case, it's millions of Californians of color. And the COVID-19 pandemic has underscored the depth and the reach that racism has on the health of children, families, and individuals alike. And as you'll see in a minute, our communities of color are experiencing higher rates of illness, death, and overall health and economic hardship from the virus. We also emphasize and stress that these disparities are not accidental, but by design. Racist policies and practices have long determined where and how Californians work, live, attend schools, receive healthcare, and much more. And these longstanding racist policies affect everyday life and block many communities, specifically Black and Brown communities, from the opportunity to be healthy and thrive. So that is a very high-level overview of our report. And again, I do hope you get the chance to read it if you haven't done so already. But now I want to talk more specifically about COVID-19 case and death rates that are broken down by race and ethnicity and account for age. And what we found especially alarming about the case and death rates after adjusting for age is that many of these racial and ethnic groups most affected by COVID-19 are generally younger than other demographic groups. So if you could go to the first slide. Yeah, thank you. So I'll be starting off with COVID-19 age-adjusted case rates. And the data you're seeing right now are about a week old, but they will still help us understand the impact that COVID has had on communities of color. And as you can see at the top, Native Hawaiian and other Pacific Islander Californians and Latinx Californians have experienced the highest rates of COVID-19 infections. So this is a second chart, and this chart shows that COVID-19 fatality rates by race and ethnicity also adjusted for age. And just as you saw previously, the racial disparities are dramatically apparent in the COVID-19 death rates as well, unfortunately, again, with Native Hawaiian and other Pacific Islander and Latinx Californians at the top. And to reiterate, these age-adjusted comparisons are important because it highlights the proportional disparities between different racial and ethnic groups based on the number of individuals within each age group. And it allows us to more easily compare communities with different age structures. So for example, part of the reason why that the COVID-19 infections and death are alarming is considering that certain racial and ethnic groups like Latinx communities are generally younger than other demographic groups, which means this demographic tends to have more children or just not as many older adults. So really, they should not be dying at such high rates from the virus, considering that one of the primary risk factors for severe illness and even death from COVID-19 increases with a person's age. And there are a lot of different factors of why we're seeing this. Some people of color have a higher risk of infection, partially because they're more likely to work in essential services, live in multi-generational homes, and lack access to worker benefits that will allow them to stay home if they do become sick. And equally as important, we can also point to racist policies and practices that have long undervalued and underinvested in the health of BIPOC communities. And you'll hear more about this later on in the panel. And then, next slide, please. So switching gears a little bit now, you may hear us use some of the following terms as we go on in the presentation. So we just wanted to highlight a few to make sure we're all on the same page. And specifically, I wanted to draw attention to institutional racism and structural racism. And for the record, these terms in this table, along with a more comprehensive one, is in our report if you want to just follow along there or use it as a resource in the future. But I did just want to pause here for about a couple of seconds to give the audience a chance to look over the definitions. Okay, thanks. So I'll wrap up hereby really underscoring that the racial health disparities in COVID-19 cases and deaths confirmed what many of us have known for a really long time. And that is that racism is a public health crisis because it directly harms people or interferes with their ability to live a healthy life. And while I won't go into too much detail now, our report makes the connection on how racism and racist policies in various institutions interact with on a daily basis affect health generally and have placed people of color at a higher risk of harm of COVID-19. And in our report, we specifically highlight the intersection of racism and health in housing, the environment we live in, employment, healthcare, the justice system, and education. And with that, I'll now hand it over to Crystal to kick off the great panel we have planned for you today, who will speak more on some of the topics we introduced. Thank you.
Thank you so much, Monica. Great job. And good morning, everyone. Happy Women's History Month. So happy that we have a panel of freedom fighter women to have this discussion this morning. And I'm looking forward to a rich discussion. I'm going to bring the panel out now. First, we have Zella Knight from Housing California's Residents United Network. Next, we have Rosemarie Molina with Los Angeles County Federation of Labor. And then Adriana Ramos-Yamamoto, California Budget and Policy Center. Welcome, sisters, and happy Women's History Month. Good to see you all. Going to dive right in with our first question and ask you to kind of create a little bit of context for our conversation. Can each of you share how you see racism and racist policies manifest in housing, employment, and health? And then also let us know what are the communities you are part of seeing and feeling as a result of those racist practices? Anybody want to go first, or you want me to pick someone? I definitely am open to self-selecting and not being called on by the moderator.
I'll begin the conversation, Crystal. I'm an American descendant of slavery, and so institutional racism, structural racism, has been a dynamic, especially in the housing realm, that has prevented many of my generations from having the opportunity to have an equity platform to live by. In my own shared experience, I have cycled in and out of homelessness, having housing insecurity, despite the fact of coming from an upper middle class environment. I experienced a health condition for which I had to utilize having a housing choice voucher. And then subsequently, in an attempt to use that as a vehicle to live on, I experienced discrimination, not just in the aspect of race, gender, and other biases, but in regards to having that voucher. There was a stigma associated with it. And so the catalyst in my effort to live or have housing as a human right, I'm oftenly upended with that because, again, the institutional and structural racists and biases that were created by structures, policies, procedures, practices, that's still an element that in my lived expertise and experience, I got to thrive on and survive on.
Thank you. Yes. Thank you, Zella. Adriana, you want to go next?
Sure. And I just want to say thank you, Crystal. I'm very honored to be here today to talk about this important issue affecting the lives of Californians. And I also want to say thank you to Zella for sharing your story. To talk a little bit about health, there's a lot of research documenting how racist policies and practices persist in healthcare and how that impacts health. People of color experience long-standing barriers to healthcare, such as lack of health coverage, limited access to transportation to get to appointments. It can be difficult to find services that are culturally competent and linguistically appropriate, and other forms of racial discrimination that happen within the healthcare setting that Zella has already pointed to. So I want to focus on access and highlight just one example of a policy that creates and perpetuates racial health disparities. Racist federal policies block undocumented immigrants from accessing comprehensive health coverage through Medi-Cal, which I'm sure you all know is California's Medicaid program, or from purchasing federally subsidized health coverage through the health insurance marketplaces such as Covered California. And this exclusion has always been harmful, but is especially problematic during a pandemic. Because, as I'm sure you all know, people who have health coverage are more likely to receive preventive care and treatment for chronic health conditions. Access to healthcare is very critical for promoting and maintaining good health. And health coverage also helps people avoid large medical bills that can cause financial hardship. So this is just one example of many where communities of color have been blocked from quality health. But the reality is that our government, healthcare systems, research institutions have a history of enacting policies and practices that harm Black, Indigenous, and other people of color. And I could go on, but I encourage you to learn more from our report and also to get acquainted with the endnote section so that you can learn even more. I think, this goes without saying, but we can all learn more about this topic and definitely including myself.
Yes, the learning continues, and thank you for your labor on this important project. Such a groundbreaking report in so many ways that is really crystallizing, no pun intended, the issues that we already know are there, but you've put it in writing, and it's such an important thing to do. So thank you, and thank you again, Zella, for sharing your testimony and just your life story and experiences. So Rosemary, come on, hop in. Tell us your thoughts about this context of racist policies manifesting in housing, employment, and health.
Awesome. I want to go into the employment aspect and talk about work, and I want to take us a little bit back in history for context. So we have a complex, that's a nice way of saying it, labor history in the United States. The foundation of this country and our economy is built on slave labor. And really, this has to do a lot with capitalism. Capitalism is the economic system of the US and the global economy. And capitalism is when companies produce commodities for the market and have to stay competitive by extracting the most labor and resources as possible. So it's all about extraction at any cost. And capitalism thrives on racism. And because racism tells us some people are less than or expendable, that's where capitalism is most comfortable, right? When capitalism and racism are working hand in hand. And so we look back in our country's history at slavery, that was free labor, right? Capitalism was maximized at that point. And slavery didn't end because of a righteous fight for humanity or racial justice. It ended because, and this is arguable, but because of a competitive advantage that Southern folks had over Northern capitalists, right? One was getting free labor, one was paying wages. And so when slavery was abolished, those capitalists lost a competitive advantage. And since the abolition of slavery, our system of capitalism has tried to make it so that labor and working conditions get as close to that as possible. And we've written it into our policies and our laws, right? And so throughout history, where workers have fought back, where they have organized, and sometimes it's in unions, but a lot of times it's just being out in the streets and organizing and going after the boss, that's when we've seen the most balance of power. So going back to the foundation and how this affects our policies and how racism is promoted through policy, one of our strongest labor laws in the country through which people are able to unionize is the National Labor Relations Act. And that was built and rooted in racism. The two industries that were excluded from that act back in the 30s were agriculture and domestic work. And if you look at who was doing that work, it was Black people and largely Black women in domestic work. And so what does that look like today? What do these patterns and policies, how do they affect us today? Well, now we see patterns of exclusion and exploitation, where you see the exclusion of one group not being able to access work. You see the massive exploitation of another. So the car wash industry, and I'm talking about Los Angeles now, the car wash industry, the garment industry, the janitorial industry, hotel housekeeping, farm work, domestic work, a lot of factory work. It used to be largely Black labor and Black industries and union. And now it's mostly undocumented immigrant workers and women who are in these non-union service sector below or under the economy industries. And so we see now that a lot of Black folks can't even get these jobs. They're completely being isolated, and that's led to a 50% unemployment and underemployment rate in Los Angeles for the Black community. And those people, again, that are in there are undocumented folks largely, being exploited, not being able to access the same rights that we do. Other policies that we can look at if we wanted to go into it is prison labor. That's another way where they're trying to drag that line all the way back down. People literally working for free while incarcerated. And then you see just the underground economy. There are so many parts of our economy where it's just cheaper to pay the fines and operate illegally than to actually abide by the most basic human rights standards, like access to bathrooms or paying wages at all. And so this is how we see, racism come up through policy, but there's a long history of it. And really, when we look at capitalism, it's feeding off of that racism.
Thank you, Rosemarie. Thank you for breaking that history down for us. Brian Stevenson of the Equal Justice Initiative has a statement he's made, and it's that slavery never ended. It just evolved, right? So that's what you just told us, that so much of what we see happening today is an evolution from slavery. So thank you for breaking that down. So building off of what you all have shared, excuse me, Black and Brown communities are facing structural racism in these areas: housing, work, health. How has this made communities vulnerable to the virus and the recession? Just want to get your thoughts on that. And Zella, will you kick us off again, or we can switch up the order this time? It's fine. I'm flexible.
I'll be more than happy to kick it off. Specifically for American descendants of slavery, such as myself, we're looking at here in Los Angeles, liquid capital of $200. Liquid capital, which means we have to survive on that. Whereas other counterparts, we're looking at on an average anywhere from approximately $70,000 on up. $200 liquid asset to survive on. And so in a day-to-day journey, you're having to eat, provide your health care, transport yourself, house yourself on $200. That's the level setting of what structural and institutional racism has created. The intersectionality in the effort to, again, have the highest quality of life for all of us as an American descendant of slavery can't do. Those systems and structures are still there. They're still impeding. They're still hindering the communities. The communities are systematically being displaced, not just in housing, but in all of the intersectional dynamics. And it's critical in when you're traumatized, as many of us American descendants of slavery has been and continue to be, in an effort to trying to survive. When you again have those structures in place to prevent you from being at an equal or higher playing field, you're still left on the bottom. What do you do? What do you do? And so right now, many of us are in survival mode and continue to be in survival mode, generationally after generation.
Yes. Thank you, Zella. Surviving. We want to take folks to thriving from surviving, right? And that's our commitment in disabling racism and really living the anti-racism that we want to see everyone embrace. Adriana, would you like to go next?
Sure, yes. Back to your question, I'll focus on health. Health is a huge part of this conversation, right? We wouldn't be in this economic recession if it wasn't for this health crisis. So we know that communities of color are at a greater risk for severe illness from COVID-19 if they become infected due to higher rates of underlying conditions, or at least in part due to underlying health conditions. And I'll give some examples to sort of illustrate what I mean. So Black Californians have the highest incidence and mortality rates for various types of cancer, and having cancer increases the risk of severe health consequences from COVID-19. We also know that Black, American Indian, and Latinx adults experience higher rates of obesity, which is also considered to be a risk factor for severe illness from COVID-19. About 1 in 5 Latinx Californians reported that they didn't have a usual source of care, and 1 in 6 experienced difficulty finding a specialist. And I also want to mention Native Hawaiian and Pacific Islander, that population Monica highlighted earlier today, are often overlooked because data is not collected in ways that really target these groups. So there's some studies that shed some light on underlying health conditions for this group as well, but we do need to do a better job of collecting data, disaggregating data. The UCLA Center for Health Policy Research is doing some good work around that. But if we can take one step back and ask, well, why do we see these racial health disparities in the first place? And Zella has already spoken to this already. Historic and ongoing racist policies and practices have barred children, families, and individuals from equal access to healthcare, employment opportunities, housing, education, and other opportunities to thrive, as Crystal aptly put it. Communities of color, they have these underlying health conditions that make them more vulnerable to health threats like COVID-19.
Yes. Thank you, Adriana. Something that your comments brought to mind is in the report, you talk about chronic stress and the impact of chronic stress on communities of color. Someone I want to put on everyone's radar, if she's not already, is Dr. Amani Allen, formerly Nuru Jeter of the UC Berkeley School of Public Health, who was the first person to teach me about allostatic load and the impact of folks of color being under such high stress due to racist policies and practices and being a person of color in America, that our allostatic load never comes down. We're consistently at these high levels of stress. And that, of course, exacerbates other health issues when your stress levels are intended to ebb and flow, right? But ours are just staying here. And so our bodies never get a chance to recover. So thank you so much for highlighting that in the report. And I just wanted to give Amani a shout out as a young woman of color, researcher and thinker and academic in that space. So Rosemary, chime in, tell us your thoughts.
Yeah, I think what we saw from this pandemic is that the majority of our essential workers are people of color. And before we called them essential, before the pandemic, we called them low wage or low skill or a lot of other terms, but now they're essential. And what's interesting about that is that essential doesn't mean much, except you're getting the shifts that are available for work right now, right? It didn't translate to hero pay. It's not translating to better benefits or healthcare or even the most basic protections at work, but yet we're saying they're essential. And what we saw from the report is that essential workers have really high infection rates. People of color have high infection rates. And it's because of all of the pre-existing health disparities, but also because these are the folks that were at work. They were out there in the public. And work, we saw from studies in San Francisco, is where transmissions are happening. And there was a complete failure of protection for these folks. And they're bringing it back to their families. And I can't tell you how many of the organizers I've talked to, organizers exist to help workers find their rights or to speak up at work or to connect them to the resources so that they can become empowered. During the pandemic, organizers turned into places people could go to figure out how to bury their loved ones, going to funeral homes with people, trying to figure out how to close accounts. And it was just really tragic what happened. But what the COVID did is it just shined a brighter light on the inequities that already existed in this system. And we can say essential and use fancy terms, but let's not forget how we thought of folks before the pandemic, right? And if they are essential, let's treat them like they're essential, right? So that's mostly what we saw. One other thing is that if we look back at the recession of 2008, the communities that were hit hardest were Black communities and brown communities. And not only were they hit hard by the recession and loss of employment and loss of economic stability, but they were left out of recovery conversations. How are we getting folks back to work? And so we want to make sure that's not happening now. When we think about recovery, we can say that Black and brown communities are typically 4 years behind other communities. So if we know that, plan for that now, and let's not leave them behind. So that's what we're working on.
Powerful, powerful. Thank you so much for adding that to the mix.
Crystal, can I interject something?
Of course, this is a conversation. Mix it up. I love it. Go for it.
Rosemary, the term essential is actually a code word. And the reason why it is essential, it is most of those folk who are in the front lines, work was necessary to survive. In California, we have a high cost of living, but yet the wages do not equate to that. And so you have to double up, triple up, quadruple up in some instances. Again, I referenced the fact for American descendants of slavery, our liquid wealth is $200. So you have to multiply that just to survive here in California, just to survive here in Los Angeles. So the term essential has that dual-edged sword. Yes, in the workforce, it's an important aspect. You need those folks for the food, the healthcare, and other provisions, but the other side of the fence is those folks are needed to survive and thrive on. We have families who are multi-generationally living in one home because you cannot live on your own with $200 to pay as rent. So you have all of those dynamics that are contributors. And again, there's not going to be any such thing as recovery. We are talking about repairing, because these elements that created this never cleaned the state from the pre-pandemic even into the pandemic. So until we acknowledge the fact that those elements, such as the concept of essential, are dismantled and destroyed, we will continue to recover. We need to repair, build, and as Crystal alluded to, thrive.
Yes. Thank you, Zella. Rosemary gives you the thumbs up. Yes, thank you so much. Let's dig a little deeper in terms of some population health outcomes. We got some questions before the program. Folks wanted us to really talk about how we weave and talk about racial and health disparities and all of the issues we've been talking about and how it really impacts population health outcomes. So will you, maybe Adriana, start us off, since I know health's your cup of tea and real strength, and then others can chime in as well.
Sure, absolutely. Happy to start off. So I want to talk about the social determinants of health, which are the conditions in which we live, learn, work, play, age, that largely influence health. These are the upstream factors that impact health. And so, in other words, the context of a community matters for your health. And racism, unfortunately, is baked into that context. Racial health inequities are a result of decades of inequality in housing, employment, healthcare systems, education, and more. I know we said this a few times already, but I think it bears repeating. So let me just highlight one concrete example of what I mean. Our environment. Everyone deserves to live in a healthy environment, but the reality is that communities of color, particularly Black and Latinx Californians, are more likely to live in neighborhoods with poor air quality in closer proximity to hazardous waste sites than white Californians. Also, Black, Latinx, and Asian Californians are, on average, exposed to more pollution from vehicles like cars, trucks, buses than white Californians. And this is important because harmful chemicals and pollution in the environment contribute to respiratory and cardiovascular health problems, including asthma, lung cancer, and heart disease. And on top of that, other environmental factors, such as limited access to nutritious foods, sidewalks, parks, can make matters even worse. Research shows that neighborhoods with limited access to healthy foods contribute to racial, ethnic disparities in obesity. As we pointed out earlier, that leads to severe consequences from COVID-19. So these toxic, unhealthy conditions are harmful to health, and it increases the risk of severe illness from COVID-19. And I just want to emphasize that this is not accidental. Environmental factors are deeply rooted in racist policies and actions, such as government-supported housing discrimination, segregation, unequal distribution of power, and disinvestment from communities.
Yes, yes. Thank you, Adriana. Zella or Rosemary, would you like to hop in on this topic? Or if not, we can move on to the next question.
I think the one added factor that we continue to miss is the trauma that these policies have created. That is also a contributor to the health factor. People often have the misnomer that obesity means a slowful, lazy person that eats, and that is not oftenly the case. Obesity is created because the body is fighting itself in regards to the stress and other environmental aspects, including the neurological aspects of it. So these are contributors that hinder and continue to keep our populations bottom cast. And once we clearly, again, we can continuously have these conversations over and over again. We can continually talk about and emphasize the importance of surviving, thriving, and living. But until we as the collective, that means legislator, policymakers, people, communities come together to dismantle these ills that are impacting our lives, we will continue to hear these numbers grow. We will continue to have these lives no longer matter, and we will continue to lose lives.
Thank you, Zella.
Yeah, thank you. I just want to say too, there's a few ways that I think about this. There was a study that was done by the Federal Reserve Bank of San Francisco a few years back that showed every additional $10,000 you make in income actually adds a year to your life. And we can overlay that with different things, but it just shows that wealth can buy you a little bit of health because of the access it buys you sometimes. I think another thing I want to talk about is that working conditions and work and being poor affects people's health. There was a study done by Human Impact Partners back in 2015, I believe, and it showed that the majority of people living in poverty were working more than one job. So we're talking about working poor. We're saying you can work full-time, you could work more than full-time, double time, and still be poor. And because there are bad political systems and bad policies that don't account for wage theft or other things that workers experience at work all the time, that's exacerbating it. So people who are working poor experience higher rates of hypertension, higher rates of diabetes, and also effects of what they call time theft. If you're working 2-3 jobs and you have children, you don't have time to spend with your children. And so that was causing depression and anxiety and other issues among parents who couldn't be there because they were working. And so I think work is definitely tied to health. I think if you look at who the working poor are, it's Black and brown and Asian folks, if we're honest about it, in California. And I don't think any of this is by accident. I think it's all connected on purpose.
Thank you, Rosemary. Adriana, you want to hop back in?
Yeah, absolutely. Because I definitely second what Zella and Rosemary just said. And I also just want to come back in and emphasize that your health behaviors are just a part of the factors that influence your individual health outcomes. The other major part of it is your environment. So what's going on in your environment, what stressors are you facing, and how that all goes back to your health. So I just wanted to emphasize that. And also on worsening outcomes, there was a recent report that found that the overall life expectancy from COVID has decreased by 1 full year. And I also just wanted to talk about the health disparities there. So for Black people, the average life expectancy decreased for almost 3 years. For Hispanic Latinx folks, it was almost 2 years. So in comparison, the life expectancy for white people decreased by an average of almost 1 year. So this all goes back to the population health outcomes and how that's been worsening from COVID-19. And it was already, apparent before the pandemic.
Yes. Thank you for chiming in on that. It makes me think of when I used to be at the California Black Women's Health Project many years ago. Shout out to the current CEO, Sonia Young Adam. We had T-shirts and bags that said, "What's race got to do with it?" on them. And we'd wear them around. And of course, it was a play on the Tina Turner song, "What's Love Got to Do with It?" But, the point is race has everything to do with it, right? And we've got to unashamedly and intentionally not allow folks to not allow folks to make us back off of that, focusing on the differential impacts of all of these issues on folks based on race, because race does have everything to do with it. So thank you for all of you for bringing up those topics and responding to my question. I want to move on to the next question, which emphasizes a little bit of what you've already lifted up, but it'll allow us to dig a little deeper here. We started this conversation on structural racism, which is a result of public policies and practices. How can we center communities of color in our policymaking? What are some anti-racist policy solutions that you'd like to lift up? Anybody want to start us off?
I'll take that task on. The most important aspect in regards to this is those of us who have the lived experience and expertise to be at the center. In the work that we do, nothing about us without us. And in addition to that, we are seeking permanent chairs, not the sliding chair, not the folding chair, not the moving chair, not the bending chair, permanent seats at the table. Because as we know in our political structure, that dynamic evolves and revolves. But our lives, the impacts of our lives do not. Everybody has the human right to live. Everybody has the human right to have housing, access to health, and right employment. We all have that right. We all are striving to get that wealth gap closed. We should be connected with that. And in order to do that, you have to understand and walk in the shoes of those of us who've been impacted by that. That's first and foremost. Particularly right now, in this dynamic of the pandemic, we're going to have to be clear and specific in regards to how we're going to operate. We can no longer operate in a crisis mode where we're putting Band-Aid after Band-Aid after Band-Aid, and we continue to bleed. The first and foremost aspect that we can do is we need to declare racism a public health condition and crisis, first and foremost, and then dismantle those systemic, structural, institutional elements and ills that are preventing all of us from thriving and all of us from having those equitable elements to live. That's first and foremost. Crucial, critical about saving lives, as everybody in the mantra, from health to employment to policy making are talking about, then we need to act upon it today.
Yes. Couldn't have said it better myself. Love it, Zella. Adriana, you want to hop in next?
I was going to say the same thing, Crystal. I don't know if I need to. But I agree. I think California policymakers can start by declaring racism as a public health crisis. This is a very important first step in confronting racism and advancing health equity. And of course, the declaration has to be followed by targeted policies and funding directly to communities whose health and economic security have been harmed by the virus. By declaring racism a public health crisis, California would join leaders in other states, as well as local regions throughout the state that have made the commitment to working against systemic racism and building healthier communities. And I also want to point out that California, we do have a coalition of many local and community leaders urging Governor Newsom and state leaders to take action on a declaration. So I want to call out the California Pan-Ethnic Health Network, Roots Community Health Center, Public Health Advocates, Black Women for Wellness, and the California Black Women's Health Project, because these organizations have submitted a letter to the governor last July, and there have since been efforts to establish an Office of Racial Equity through SB 17 by Senator Pan. But back to your question, aside from, or I should say, following this declaration, some policies that would advance racial equity include, but aren't limited to, extending comprehensive health care to all Californians, regardless of immigration status, prioritizing affordable housing support and funding in communities of color, and removing employment barriers that block Black, Latinx, and other Californians of color from stable, high-paying jobs. All in all, we really need to address the upstream factors that put many communities, and specifically communities of color, at risk during health and economic crises in the first place. And if we can't do that in light of COVID-19 and all of the harm it has caused, then when can we?
Yes, yes. Boy, you guys are really preaching today. I love it. And thank you for being on the front line and being right on the money on these issues. Rosemary, please hop in. I know you're right along your side, your sisters here, and being such a passionate advocate for these issues. What do you have to add?
Oh, I have so much to say, but I'll keep it short. I just, again, want to appreciate being able to be on this panel and talk with you all. You're right. We need to declare racism a public health crisis. The first step is acceptance. And once we accept that that is a crisis, then we can move forward. But I feel like if we don't speak it, we can't accept it. So we need to say it, and we need others who are in charge, who actually have power, to say it too, and then act on it. And then in terms of this is one of the most frustrating things about, I think, the work that I do, is the people who know the answers are the people directly impacted. And we should trust that they know the answers for what's best for their communities and their lives and their families. And so we need to not always go to the experts or the scholars or the academics or the policymakers. We need to go to the people and listen to the people. And the people might have different solutions than what we're used to, but that's okay. It's okay because it has to look different. We can't keep operating how it has been before. And so what are some of the solutions we can do? We can invest in jobs programs, in employment programs, in defeating Proposition 209 and affirmative action, which stops public institutions like our government institutions from being able to hire equitably, because there has been inequitable practices. And it's okay for us to invest in equity. And that means saying we need a Black jobs program in Los Angeles where we can build pathways for the Black community to get stable public sector unionized employment. Because what we've seen is that Black public sector workers, 2/3 of them are sole providers. They are supporting and upholding the Black middle class in Los Angeles. They're also actors in their community at higher rates than any other group. Like, they are holding up massive communities. So if we build career pathways into these jobs that we know create generational economic stability, that's true investment in change. And we can do that through our institutions. And we have a program called 1,000 Strong at the City of Los Angeles. It's a workforce equity demonstration project, and we need more of that. And we don't just need commitments to jobs programs, mentorship programs, training programs. We need funding, and we need community enforcement and monitoring to make sure that these programs are going as they say they're going to be going, right? It's not just a headline. These are real projects that can change people's lives, can change our health impacts, can change economic stability for our communities. So just some of the policy solutions we can be working on.
Thank you, Rosemarie. Very important points you add to the mix. Okay, I have a question that's come in from our audience that I want to pose to you all that centers around kind of colonialism and white supremacy. And the question is, given this report, In what ways can we begin to critique white supremacy and colonialism as it contributes to the health inequities among historically oppressed groups? Anybody want to take a stab at that? Zella, hop in.
Let me have that. First of all, we do not need to validate that. And that is the element that I don't want to utilize in critiquing. What we need to focus on is dismantling. It is those elements that created the elements that we are in currently and we will continue to be. We've continued to take the factor of acknowledging that they exist, they're right, they have the power. We have to reverse that. And so in the effort that we are in right now, again, we do our best thinking when we are in crisis mode. Let's move beyond that. Let's repair this nation, this state, the locals in what has been created, dismantle, break it, and move forward so that we all can thrive. We all can have housing as a human right. We all can have health as a human right. We all can have employment as a human right. We all can have wealth as a human right.
Yes, yes. I will want to let others hop in. I just want to say around this human rights framework, you read my mind, Zella, because that is the framework based that the reproductive justice movement was birthed upon, right, by women of color, that this is about our human rights, right? When we talk about reproductive justice, reproductive health, social justice for our lives, living healthy lives, right, in every way, and that just declaring racism a public health issue and putting race at the center and walking around with our t-shirts saying, what's race got to do with it? Everything. It really is about us centering a human rights framework that until we address race in the ways that we need to and should, and that our ancestors are calling on us to do, we really are not fully embracing the human rights framework. And so I always want us to go back to that, because I was women of color who specifically called out in the context of reproductive justice that this is about human rights, right? And we sometimes, I think, get away from that framework. So thank you for bringing that into the mix. I was like, oh, she queued me up, right? Very well for that one. Adriana or Rosemary, you want to hop in on that question around white supremacy and colonialism?
I don't have too much more to add, but I did want to go back and echo what Rosemarie said earlier. On the issue of declaring racism as a public health crisis, we really do need to acknowledge that the consequences of past and present racist policies have harmed and continue to harm underserved communities of color, disenfranchised communities. And I think an important first step as an individual is to learn more about that history. So again, I encourage you to take a look at the report and also just continue to learn from there. As I said earlier, I think we all need to learn more about this topic.
Thank you. Rosemary, you want to add anything to the mix?
I just want to say that, just like what I said before earlier, we have to call out white supremacy as something that it's not something of the past, it's something of the present. And it continues to drive a lot of how our institutions and policies run, even if people don't see it, like it's there. So as soon as we accept that and just say it and not say colonialism, it's not a thing of the past. It's still happening. We're still feeling things from it. Then we can begin to move on.
Yes, yes. Which is why we walk around with our "What's Race Got to Do with It" t-shirts and bags, right? And even though that's a simple statement in terms of what you wear, but it puts those messages front and center in people's faces. Like, this is not something we're not going to deal with. And so I'm so proud of all the advocates, all the folks that you shouted out, Adriana, who I have relationships with, California Black Women's Health Project, Black Women for Wellness, California Pan-Ethnic Health Network. I'm recently joined the board of that organization, so proud of them. And I think there was one other organization. What was the last one that did I leave one out, Adriana?
Public Health Advocates. Mm-hmm.
Public Health Advocates. Yes, thank you. I think Dr. Flo is there at Public Health Advocates, know her well. So, just we need all of our on the front lines, working on this issue, We have to, in the midst of this battle, I think we have to retain our joy. I'm always talking to our staff at the Western Center on Law and Poverty that as we do our work and we're fighting these fights, how do we maintain our joy and our commitment to our own wellness while we battle these issues? And it's so important that we center self-care, that we center laughter and joy, and that we're doing the things to kind of help bring our stress levels down. I talked earlier about that, and how can we, as we fight these battles and wage these wars, that we really center our own health and wellness. So I'm hoping that you all will be able to comment a little bit on how you center your own health and wellness in this battle and in this work, and might give some other folks ideas about how to do that. Rosemary?
Thank you. I think that's so important because this work could be draining and exhausting. And when you look at the mountains we have to climb, I don't work out very much, so it's a little hard. But I keep the stories of my family and my own lived experiences and the people I work with every day really close to me when it gets hard. And that's what drives me. I remember I was working on the minimum wage campaign back in 2015 to raise the minimum wage to $15. And I had a worker that was coming out to all these hearings and sharing his story. And he had filed a wage claim for $26,000. So that's how much was stolen from him in a year from his employer. He was undocumented. He got ICE called on him when he tried to ask for his wages back. He was a single father. But at the end of our campaign, I remember him just breathing really deeply. We were alone. And he said, "I got my dignity back. We won." And so that's what we're doing, is we're fighting for our dignity and our respect back when we're doing that. And I keep those stories really close to me.
Powerful. We've got 2 minutes left before I have to pass the mic to Janice. So Zella and Adriana, would you just like to chime in about what you do to center your self-care and wellness in this battle?
It's for me, it's the journey of being the voice for the voiceless. And so in this effort, even though some of us are going beyond stay housed, the easiest thing that I'm going to do is utilize this device, and I am going to be calling my governor, my legislator. I'm going to be sharing the report. I'm going to be emphasizing the importance of saving lives. Again, we saw what the pre-pandemic has created. We see within the pandemic what has created, and we saw life loss. We can no longer afford to lose any more lives. And so in this effort, I'm going to challenge those in the audience. Utilize your devices in an effort to move this message forward. Again, we all have those aspects that I defined earlier as a human right. And it's time for the collective to remind policymakers and others that our lives matter, all lives matter, and thus we want racism to be dismantled and ended today.
Thank you, Zella. Adriana?
I have to say, conversations like these keep me very passionate and motivated, right? I will also just add very briefly that taking care of your mental health is just so important. It's especially in these times. So if you have a chance to reach out for help if you need it, or try to take care of your own mental health and wellness through breathing exercises, meditation. I know this conversation is not about that, but highly encourage everybody to take care of their mental health right now.
Yes. Thank you so much. That's a perfect way for us to end our conversation. Thank you. Kudos to each of you sisters for all of the wonderful work you're doing. Thank you for this great report, Adriana, and your co-author, Monica. And I am going to pass the mic now to Janice to give us a few closing words. Thank you again, panel, for your graciousness and all of your wisdom. And we support you and thank you for everything.
Yes, thank you. And I'm really glad with that last ending note, because I remember of Audre Lorde's quote, "Caring for myself is not self-indulgence, it's self-preservation." And that is an act of political warfare. And I think that is very important. And We actually had a report just last week that showed that like more than half of the women in California are facing mental health, instability because of COVID. And that's so important to the work that you all are doing for and on behalf of all these Californians, right? With that, I'm still absorbing because I can't get over how insightful, powerful conversation that just happened with you amazing women leaders dropping this knowledge. So thank you, Monica, Crystal, Adriana, Zella, Rosemary. We have a lot of work going on, and the goal of this event is to make it clear that we all have to do that work, and declaring racism as a public health crisis is a critical step. But also, as you all pointed out, going to the communities most impacted for policy solutions. And that's really where Empower, this event and this series, comes from. People and policy equals progress. And we have to continue to do that. So thank you again to our audience, all of you who have joined us today. Remember, you can find all this information more on our website, calbudgetcenter.org. Special shout out to the Budget Center's Outreach and Communications team, Lillian DeWong, Mauricio Torres, Marcela Salvador, and Sarah Jimenez, who help make all of this possible. And we truly hope you leave us today with a lot of information, action steps in mind, and feeling a little bit more empowered.